Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we have a couple of the state's top journalists. We're going to give them the big stories of the week, and then our popular healthcare update. We're doing this series on healthcare updates. That continues. All of that after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, as we speak at the moment, the legislature is still trying to decide what to do about the state budget. We have a couple of other big stories rolling around the state capitol this week. Joining me, as often is the case, two of the state's leading journalists. We have Laura Olson with the Pittsburgh Post-Gazette. Her paper's out in the western part of the state, and we have a guy whose paper is in the eastern part of the state, John Micek from the Allentown Morning Call. All right, Laura, big story of the week. What are you working on?
What am I working on? Well, we spent the first part of the week working on Bill DeWeese, who got a surprise weekend furlough for himself out of state prison. There was a technicality with the judges not ruling on this order, and so he got to be released on Friday night, and by Tuesday afternoon he was back in state prison.
I was sort of surprised by that because I don't know any other defendant on appeal. John, you covered a lot of these. Gotten out, right?
That was.
He's out. His girlfriend comes, right? And they scooted away or whatever happened there.
He reported to Dauphin County Prison, which was kind of unusual because normally when you're starting a state prison sentence, you go off to the state prison in Camp Hill, which is the main processing point for all new inmates. We all look up on Friday night like, oh, well, what do you know about that? He's out of jail for a couple of days.
By the way, just for the sake, Bill DeWeese was a legislative leader who was prosecuted for a variety of public corruption charges, and he got a fairly, 2.5 to 5 year sentence in state prison for his violations. They let him out of very, very unusual. But before I let you go on this, we also have one more trial to go. Former Representative, go ahead, Laura. From York County, scheduled for what, June or July?
Sometime in June at this point.
All right, so that would end the bonus gate, the so-called bonus gate 25. But I know we're on this subject now. We have 3 sisters, all whose names begin with a J. Yes. Joan, Janine, and Jane. Now, I know this is going to be hard to take it away. Explain their situation.
All right. So we have the sisters Orie from Pittsburgh. Jane Orie, a Republican state senator, being sentenced in June on charges of public corruption. Pretty analogous to the bonus gate thing that she used public employees for political means. Her sister has been Sister Janine has been caught up in that. Now, the third sister, State Supreme Court Justice Joan Orie Melvin, has been charged by the Allegheny County District Attorney's Office for, in essence, similar charges, being part of this. She's recused herself from the state Supreme Court. It's now gone from a 4-3 panel to a 3-3 panel, which will make for all kinds of fun, I'm sure, when they begin deliberating cases.
And Sister Janine?
Sister Janine, convicted as well?
No, there was a mistrial, and I think she has to be retried, and she works for Joan. She
was an aide to Joan, that's right.
If you're confused, you're not alone out there. We're confused. But I don't, Laura, have you ever heard of anything? I mean, you go and you look in other states, 3 sisters all caught up, and literally the same thing. I mean, they're all involved in the same package of allegations, right?
I think this really has to be a one-of-a-kind scenario here. Anyway, it was on Monday that Senator Orie, Jane, stepped down from her legislative seat. She has not gone to jail yet. But
all right, we're going to run to a break. John gets his big story, and then we're going to bring up, well, if it's May and June, we got to talk about the state budget. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program with John Micek and Laura Olson, both journalists. All right, John gets his big story of the week. Don't tell me it's about corruption, public corruption.
No, but it's got money. So
Let's
I mean, it's a great political story. It's we're being broadcast in most parts of the state on a Sunday morning. So if your readers were to go to mcall.com, my newspaper's website, they would see my story there detailing the expenses by the lobbying expenses by the Marcellus shale drilling industry during the run-up to the passage of the impact fee.
Millions.
1.3 million by the top 5 companies during the run-up to the impact fee that was passed back in February. The Marcellus Shale Coalition, the industry trade group, was out in front there. Second was the drilling company Range Resources. Coming in third was Chesapeake Energy, Shell, and then Spectra Transmission bringing up the rear.
But both of you have covered lots of stories where there's big legislation. Is there something unusual about that, about folks who are involved in pushing an agenda, spending a lot of money? I mean,
it's not in itself. I mean, industry will obviously spend the coin that it needs. There are two sort of themes running through the story here. One is the way this spending just dwarfs those by the environmental activist groups by a factor of like 10 to 1, 20 to 1. They were vastly.
Industry has more money, environmental groups.
Vastly
in and of itself,
outspent.
No surprise, but you're talking about the proportions.
But when you're talking about an issue of this magnitude, that's this hot button, they were just blown out of the water. The other thing is the issue of transparency. Pennsylvania has one of the weakest lobbying disclosures laws in the country. All these companies are required to disclose is so-called direct communication with lawmakers and then indirect communication, which is to say, a television ad says, call your lawmaker and tell them to pass X.
Right.
Beyond that, you don't know how that money is spent nor who is affected by that activity.
Yeah, Laura, you're shaking your head. Go ahead.
Well, I mean, the most specific examples we've been able to see in the past is when the lawmakers themselves have had to report things. When Consul paid to fly a few of the lawmakers to the Super Bowl. Yeah. Those types of things are what we're able to actually see. Yeah. But otherwise, if it's just under like the lobbying umbrella, it's very vague. And
the other aspect
you really have to try to cross-reference between lawmakers.
Yeah, there's a lot of.
I don't want to make too tight a connection here, but you have. In the election code, it says that if people give money to a candidate, they can use it, or an office holder, they can use it to influence an election. But now I'm going back to bonus game, but we have had several lawmakers, actually 2 of them prosecuted by the feds, former Senators Fumo and Mello, Vince Fumo, Philadelphia, Bob Mello, Lackawanna County, both of whom, and even Senator Orie, used campaign money and state dollars to defend themselves. Am I right about that?
Yeah.
But how can you use campaign dollars to defend yourself when it's supposed to be only to influence an election?
It's a gray area.
I love that answer.
I can't really account for it.
I understand.
But it's what happens, and theoretically it's not supposed to, but it does.
Yeah, and it's not been challenged in court. My point about that is if we want to allow that to be used, and now out in Allegheny County, we have the DA out there going, go ahead, finish my thought, going after Senator Orie.
Oh, yeah, going after Senator Orie for the way that she's paid for her defense fund.
Particularly
and
the state dollars.
The state Senate paid about $2 million, I think it was.
Maybe,
somewhere in that range.
1.2 million, something like that. Exactly. But you make the point that there's lots of how to put this, a lack of specificity and clarity in the law, which has allowed a lot of these unusual uses. And you cover these stories all the time in which you report on that.
Well, and just to put the 1 million lobbying figure into perspective, this September, all of the drilling companies combined are going to be paying impact fees that total somewhere about $180 million. So
right.
You can judge for yourself what the return they got on their money. We're
going to run to a quick break, and when we come back, we're going to get into where the state budget stands. I'll let the journalists explain that. They can figure that out. It's a little complicated, but I'm sure they can do that. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
All right, we're going to talk a little bit about the state budget. Carolyn Scanlan from the Hospital Association is going to come on in a moment or two, and we're going to pick up the health care piece of it. But, John, I'll start with you since Laura spoke last. John, state budget, Senate says no to the governor's request. They restore about $500 million because revenues are up in the state. It's now over in the House. What's likely to happen there? All right, well, the House, the budget came out of the House Appropriations Committee beginning of last week. Okay. Some interesting parliamentary gymnastics in a very long Appropriations Committee meeting where they basically capped spending at $27.6 billion, the amount approved by the Senate. That scuttled a bunch of attempted Democratic amendments. They wanted to add more money back into the budget, arguing that revenue collections supported more restorations. It got very heated. It got very argumentative. But something new, right? Nothing particularly new. They would argue, but nothing particularly new. But it was just kind of funny to see the Republicans like slam down this wall and. The fate of the budget was sort of preordained from that very moment. Yeah, I think from my conversations with folks, Laura, there's this cap, 27.6. It's pretty firm. Tweak the budget, the governor has said, right? But the governor also now has injected pension costs. We also have, almost $4 billion the state has to pay into the workers' compensation fund, maybe float a bond. We also have prison costs at $2 billion. Talk a little bit about these huge costs. Go ahead. Go through the long list. We've got a long list. I mean, those are the biggest highlights. And the question is, like, how much you can do this year and how much. Some of it he's setting up for the next budget because lawmakers are saying, you know what, those pension costs, beginning with next budget, are going to become something we actually can't carve out enough to include in our spending plan. And so he's kind of putting some of this on the table for now. The thing we really haven't heard from the governor yet is how much of the revenue above what we estimated, not a surplus, the revenue above what we thought we were going to have, he's willing to spend and how much he wants to keep. And no one knows for sure until the day, the end of June, what last year's revenues will be, so they're in a kind of a guessing game. The governor apparently wants to be more cautious about it. Is that right? Yeah, and he said that he's open to using some of that, but hasn't been very specific at all about how much he'd be willing to put back. But pension costs, and in all fairness, as a former professor at Millersville, I'm in the state pension system. I always get that out. Truth in advertising. It's your fault. Yeah, I know. I'm just a simple little professor teaching. Don't get me into this, John. All right. But here's the bigger point. Over $1 billion a year being spent, and now it looks like the pension costs are up to about 37 or 40 billion. We thought it was about 29 billion after the last pension fix. Unemployment compensation, as I pointed out, and we got this concern about roads and bridges that everybody wants to do, but cost about 1.7 billion a year. Is there any way out of this? With the exception of like large sacks of cash falling from the sky. No, I mean, it's a gigantic shopping list. I mean, the one thing it looks like they may do before the end of June is float some sort of bond, taking advantage of market conditions now. Good point. To repay the the hilariously debt-averse Corbett administration floating a bond to pay for $3.7 million in borrowed. We have about 30 seconds. Yes or no? They want to do the budget by June 13. Laura Olson. Is that reasonable? Does it look like, maybe the third week, June 13, yes or no? Hey, in Jake Corman's words, it's always good in life to have goals. I love that. John, can they get it done by the 13th? Just so my vacation plans don't get scuttled, I'm hoping for yes. But they'll definitely do it by the end of the month and meet the deadline. You both agree there. Absolutely. All right, we're going to turn to the health care piece of this after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. Well, joining me as often is the case is Carolyn Scanlan. She's the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. Carolyn's one of the experts we bring in from time to time to talk about health care. We're doing a series of health care updates. Carolyn, before we get to the budget in PA, within a month we could see the Supreme Court decision in the constitutionality of the Affordable Health Care Act. Critics call it the Obamacare, so if they don't know by the formal name. What are the ingredients that we should look for, our viewers should look for? And the debate will begin, as you know, leading up to this.
So let's talk about the Affordable Care Act for a minute. It's rather broad, and it did three things. It did insurance reform, and part of that insurance reform is a controversial piece about requiring people to buy insurance, the mandate.
Right.
There's delivery system reform, how hospitals, doctors, and others deliver care. And there was a large piece to help people get primary care and preventive care. Mm-hmm. So some of the things we've seen already, some of us are able to carry our children on our health insurance policies till age 26. Children who had pre-existing conditions can now buy insurance. States have set up high-risk pools for people who had pre-existing conditions and couldn't buy insurance.
So but let me interrupt you, because you're saying something that I hadn't heard before. Children could get coverage. Can adults get coverage? Is that under the state plans?
In that risk pool, that high-risk pool.
Okay.
In 2014, should the law stay in place, there's something called a guarantee issue, which means anyone with a pre-existing condition is guaranteed the ability to buy insurance.
That's 2014.
That's 2014. Okay. The other piece that's already in place is, you'll recall in the Medicare drug program, there's something called a donut hole for where drugs are not covered for seniors. The Affordable Care Act begins to close that donut hole.
And that's an age deal, right? If you fell into a certain age category.
And it has started, that closure. And then secondly, seniors on Medicare get full coverage under the Medicare program for primary and preventive care, which before they did not get. So what's at issue? What's at issue are three things that got argued before the Supreme Court. One, and this gets technical, and I am not a lawyer, about arguing whether the mandate for people to buy insurance can be covered by the Commerce Clause.
Correct.
Secondly, whether states are being coerced into expanding their Medicaid program as part of the coverage up for 32 million more people. And lastly, if any piece is found to be unconstitutional, can it be severed or separated, or does the whole law go down? So it's a pretty significant act or action that we're waiting to hear from the Supreme Court.
Well, it's huge. I mean, not only would we get an interpretation of how far you can go with the Commerce Clause, but you also get all these pieces to it that relate to the delivery and then to the folks who receive medical services, so that this decision is going to have huge health care ramifications. We don't have to get into the political side of it. We know what will happen there. It'll, you know, side that loses will be outraged by it, but huge consequences for the health care system.
And for financing, because hospitals also said that we would take less payment from Medicare and Medicaid for Pennsylvania hospitals, $7 billion to pay for people to get health insurance. So we contributed to that mandate or expansion. If that goes down, we still have a $7 billion cut, which would be inappropriate and unfortunate. So what I think is there's a lot of unintended consequences or consequences. Some don't even understand, most of us don't understand all the things we've already gotten that we'll lose.
Right. Let's go to, you heard this discussion I was having with John and Laura about the state budget. It's over into the House. As it now stands, given what exists for the cuts that were made originally by the governor, restored by the Senate, well, first of all, what were they, and how does it affect medical services in our state, particularly hospitals?
Well, the governor's budget did a few things on cutting very specific payments to hospitals and categories of individuals who could get care and hospitals get payment. What the Senate did was they restored a large part of the hospital payment cuts. And we appreciate that restoration by the Senate. There's still a couple of places where there are individuals, populations of people who have high health care needs in what are called general assistance population that we'd like to see some more funding restored in that area. And we think that maybe the counties could get a little more money restored. But the Senate did, I think, an extraordinary job within the framework of the additional revenue that was available,
right. The
$500 million
about, right.
to restore across a whole series of interests.
Well, there have been a lot of rallies and a lot of discussion and a lot of emails and letters written about both the education and the health care parts of it, which I think in part helps explain what the Senate did. Now, over in the House, it looks like they set the same number,
yes.
Big number. Do you expect much that most of what was restored will stay there?
Well, we've been asking the Senate to leave in place what the Senate did for hospitals
right.
and health care.
The House, leave the House.
For the House to leave
sure.
what the Senate did in place. You know, I think that the Senate, that the House will put their own mark on the
sure.
budget. But they also in the House appreciate that hospitals are sort of the mainstay in their communities, large part of their constituents in their districts.
Right. Big employer.
Have heard from their hospitals on how important this funding is, and we're hopeful that the House will keep what the Senate did in place.
Well, pushing it further, the Medicaid costs to states simply seem to me to be, that there has to be some other kind of fix going ahead. When you take Medicare and Medicaid, I mean, you're talking about, larger numbers of people qualifying for Medicaid now because of the recession, putting additional pressure on all kinds of providers.
That's true, but the largest part of the Medicaid budget in this state and across the country is still for those people who are 65 and older,
right.
who are in nursing homes,
right.
Or home care or other community-based programs. And I think we have to become more innovative on how we deliver those services. The federal government is looking for demonstration projects on how to combine Medicare and Medicaid, same person, same care, same issues. And so going forward, we're going to have to figure this out better.
Yeah. Well, the final question is then, budget, if the Senate keeps it the way it is, you're happy with it?
We're happy. We'd like a little more. You wouldn't want us to not want to ask for more.
Got it.
Because it does affect the health care and access for all individuals across the state. But the Senate took a large leap, and we are appreciative of that.
All right, thanks for the great update. All right, thanks for watching this edition of Pennsylvania Newsmakers, and as always, stay well.